So tell us about the myocarditis and what you think is going on with your myocarditis, and explain how you're catching some of these myocarditis in patients.
Yeah, so the myocarditis, definitely, we've seen such an uptick of myocarditis that, and I spoke about it back in January, where prior to 21, myocarditis rates were just so rare. I mean, 4 in 1 million cases. And now it's gone up to 25,000 and 1 million. And there's argument and discussion about what is causing this, right? And we always have to kind of look at, when we're looking at someone's history, what has changed since January of 21, medication-wise. Have you gotten any new injections? Those kind of things. We have to ask all those questions. Now, in my case, myocarditis is inflammation of the heart muscle. And where did I pick mine up? There's been a lot of discussion about, did it come from? I've read articles where they've looked at all the autopsies of folks that died from true, and they did not find myocarditis. So I have a hard time convincing myself that mine came from getting the infection. Did it come from something else? I don't know how controversial you want to get here on this topic.
I just want you to be honest. Educated.
There's the concept of shedding and transmitting.
Yeah, I've heard it. Dr. Peter McCullough talks about it.
Right. And yeah, even within the Pfizer documents I've read, I got some documents December 2019 where the Pfizer documents talk about the potential shedding through exosomes, breathing, sexual intimacy, breast milk. So is it possible that my myocarditis has come from shedding? I work with a lot of vaccinated folks, and it's just a question mark that I have.
Yeah, it's something we should ask, and we need to know, and it's something that you probably look for when you treat these patients, and you ask them those questions so you can treat them appropriately.
Right, and I have seen a greater number of my vaccinated folks with myocarditis, and so then I have them do the homework of, okay, put your lot number into this website where you can find out, your batch number, and did it come from complications. And I had one patient recently say, yeah, my first batch had 10% complication risk. The second batch had 7% complication risk. Well, that is way too high.
Right. Topic for a whole nother podcast.
Right.
So Olga, when I was talking to her a few weeks ago in your office, she was discussing how you guys can look at these cardiovascular risk profiles now, and you can tell if people have been on hormones or not. Tell us about that.
Oh yeah, no, that's a huge factor too, and this is where I'm competitive. I love competition. I know if Dr. Sam's heart attack rate is 1.2, I know Olga and I can beat that. Yes. So, and hormones play a huge role. Whether it's, estradiol for females, and how it prevents the deposit of amyloid plaques to the heart, to the brain. It helps with cholesterol. It's huge. And so we can see that in our patients that are on bioidentical hormones. It's amazing.
And men with testosterone?
And in testosterone, yes. What testosterone does for cardiac output for men is huge. Testosterone also, helps lower cholesterol, helps decrease the risk of diabetes. So no, it's, I should challenge Dr. Sam. Okay, 1.2, I think we can go less than 1.
Go to less than 1. Exactly. That's what I'd shoot for about you. So when I was discussing that with Olga, when she was discussing those results, we were both, very happy about that. And in some ways we were surprised, but then I just reminded her, we weren't surprised, but we were like, wow, this is cool. We can see this. But you and I had been to the same hormone training seminars with Dr. Rosier, and this is what he teaches us. So we really shouldn't be surprised how beneficial hormones are for cardiovascular disease. Now, the traditional medical system, you're not taught that. In fact, there's bad studies out there that shows that, testosterone causes heart attacks in men, estradiol or estrogen increases cardiovascular events in women, and those are just totally debunked when you look at the results from these panels you're talking about.
Right. No, it's great to have now this multifunction cardiogram that really gives us more objective data than anything that's out there.
Right.
Yeah.
Exactly.